Lumps, bulges, and other changes in the breasts can be easily located with self-breast examination. There are a few positions which help us identify these changes.
This is a very important part of breast care because this is the only cancer which, if detected earlier, can be cured completely. That is why the breast care examination, and plus all of us can do it at our convenience of home without getting panicky, without getting disturbed, and just knowing a little more about our body. The steps for self-breast examination begins with you standing in front of the mirror. Look at your breast, observe the size, the shape. Usually one breast is always a little smaller than the other, so that is a very normal variation of the human body. No two breasts are equal, but if there is a very marked significant difference in the size, that is something which you should note. When you start off, raise both your hands above your head. When you want to examine the right breast, use your left hand palm to be particular. Don't use the tip of your fingers, use the soft counter of the finger and start palpating your breast all over. Start from the outer circles and go inwards slowly and gradually. Feel the breast, whether it's soft, whether it feels lumpy, whether it feels nodular. Then come to the nipple and the areola region. Areola is the region which is around the nipple. Feel it, and at one stage, just squeeze, give a small squeeze to the nipple and see if there is any water, discharge, anything coming out. Of course, in a lactating woman or a breastfeeding mother, there would be milk, but other than that, there should be no discharge from the breast. As you have done this examination in the standing position, it is very important to do the breast examination even in the lying down position. Once you have completed the breast, then palpate under your underarms, at the collarbone, and finish your breast examination. Gradually, as you do it monthly or maybe once in 3 months, you will know what is the normal contour of your breast. So self-breast examination could take you or give you a detection more faster. You would be aware of your breast, the changes in your breast, and that is also one of the preventive measures which is to be done for breast cancer. Breast cancer awareness is an initiative of Dr. Mopin's group's Community Good Health Program. I request all of you to take advantage of this campaign because awareness is the first step of prevention and treatment.
Breasts are a vital part of a woman's body, and she should be proud, especially when it comes to caring about her body, including her breasts. A woman should be conscious of any changes occurring in her breasts. These changes are easily detectable.
The self-breast examination can be done when the breasts are completely least painful, and that is about 7 to 10 days after the periods. Check your breast every month. Look for any changes which is happening in your breast. See the size of your breast. Is there any asymmetry between the two breasts, or there are any changes in the color of the skin over the breast? Is the breast nipples itchy, or there are flakes, any discharge coming out of the nipple, or are you finding any change in the direction of the nipple, any sore which has come up over there on the breast, or you find that there is some scaling, or the skin over the nipples, around the nipples or on the breast has thickened like orange peel, or there is puckering. Immediately report it to your gynecologist because early detection is the best prevention. This is a crusade against breast cancer, which is one of the diseases cropping up on our planet, and it's a crusade to fight against this disease, to make this planet completely cancer-free.
Eating habits and hygiene, affect lifestyle, personality, and of course, health. Eating healthy food, brushing, bathing, and living in a clean environment are the basic tips for leading a good life. Like any other disease, food affects cancer as well.
Eating healthy means living healthy. So we have to take more of good foods such as fresh fruits and more of vegetables. Fresh fruits and vegetables means multicolored. The more the color in your food, the better it is. So also the use of antioxidants and phytoxidants are important for our food intake. Avoidance of smoking and alcohol is a must because these promote cancer-forming agents in our body. We should use more of oils such as olive oil and canola oil, which are monounsaturated oils, because these are known to not promote cancer. Fitness is the mantra today. To keep fit, one should exercise at least 4 hours a week. Even simple walking would do the trick. With all this, I would like to invite all of you to join our breast awareness program.
Do the breast self-examination once a month, and as soon as you see any change developing in your breast, visit the doctor immediately. Breast cancer is 100% curable if detected early. It is you, a woman, who has to keep a check on yourself. You cry, your family cries, 100 times more.